We lost our place.
We had to let go of the car, had to give up the place we lived.
I couldn't afford the rent that I was paying.
I mean, it hurts you because you can't even feed your kids sometimes.
We had no place to go. We definitely didn't have the money. I mean, rents here are ridiculous.
We are in the midst of a crisis in America, an affordable housing crisis. Over the last 30 years, the supply of affordable housing has dropped dramatically.
We really are losing affordable housing in our country every year, and there's just a mismatch between the demand and the supply of housing, and that's driving the homelessness problem.
The average poor family is spending 60 or 70% of their income each month just to pay for their rent.
There's no room in those budgets for bad luck or bad judgment. For some families, they have no health benefits. If their child gets sick and they miss a day of work, they can't pay the rent. So many times it's a very small amount of money that costs a family its housing.
Over the course of a year, 600,000 families with more than 1 million children will experience homelessness in the United States. Families make up almost half of the entire homeless population.
The issue of homelessness impacts an entire life cycle, and that if a family doesn't have a place to stay, they can't get a job, their kids will be impacted at school.
There's nobody in America who thinks it's right for children to be homeless. We see from the research that kids who are homeless have health issues.
Kids who in these shelters have 4 times the rate of asthma of the average school kid.
They have education issues and learning issues. They have emotional issues.
When people trying to raise their children are homeless, what chance do they have? They are put in a position where those children have a tremendous disadvantage. This is no way to start a young person's life.
You can't be effective as a child in our educational system when you don't have a permanent housing solution.
But communities across America are finding solutions. They are changing the way they help homeless families, using proven strategies to provide permanent, safe, affordable housing fast. This is the story of 3 communities making great progress towards ending family homelessness. Their innovative approaches are prevention, helping families in crisis keep the housing they already have; rapid rehousing, moving families quickly out of shelter and into permanent housing; targeted services, figuring out what families need and linking them to the appropriate resources; tracking results, collecting and sharing data to improve program management and planning. While these concepts are familiar to some, many communities have put them into practice and are getting dramatic results. Washington, D.C. prevents 1,200 families a year from becoming homeless. Columbus, Ohio has reduced family homelessness by 46%. Hennepin County, Minnesota has reduced it by 43%.
We don't have to live with family homelessness. We can substantially reduce the length of time many of those families are homeless, and we can prevent many of those episodes of homelessness from occurring.
There are many families who, with a little help, will not become homeless, and I think we have to think harder and better about preventing people from becoming homeless in the first place.
The first step in ending family homelessness is to stop it before it starts.
If you think of prevention as kind of like a bus route to homelessness, there are a lot of different stops where a family might get on that bus. It might be because they couldn't pay the rent one month. They might get on the bus after they've gone to housing court and been evicted. Another bus stop is when they've been doubling up with family and friends, and the host family is going to be evicted if they don't leave. So our job is to find those bus stops, find the people, and figure out what it takes to keep them from climbing on the bus.
At the front door of Shelter in Washington, D.C., they are providing services that keep many families housed.
Because of the deep investments in prevention is that we're seeing fewer number of families enter into the system.
This year, the community partnership prevented 1,200 families from entering the homeless system.
When families come in with rental arrearages, we now have dedicated dollars that allow us to pay back rent.
The average prevention grant is only $2,100, and that's such a small investment to alleviate a housing crisis for a family and prevent them from entering homelessness.
It makes far more sense and is far more economical, ethical, and moral to meet families where they are when they present, and to the extent that you can keep them housed.
The misconception is people don't work. They're homeless because they're lazy. They don't want to help themselves, where there's a lot of us out here that work every day and end up homeless.
She ended up losing a job that she had been working for 6 years with the bank. When she lost the job, she was unable to pay her bills. We helped her pay up some bills, first month's rent, enter her deposit, find a new landlord, and she was started off within a very short period of time.
When we got the keys, we knew our battle was over.
And now she is self-sufficient once again in her own apartment and taking care of her family.
Today, in most parts of the country, when a family becomes homeless, they enter an emergency shelter. Designed to house families temporarily, the homelessness system provides a vital service, but many families get stuck.
A recent study that I did with some colleagues, we found that half of the shelters were being used by families who were there for over a year and 3 months. In the end, they go back to some kind of housing. So there's no reason not to just move that process up.
Over 300 communities have committed to a new and different approach.
Instead of relying upon a system of facilities and shelters as a long-term accommodation to the homeless problem, they've made an explicit policy decision.
Dollars have to follow the policy decision. The answer is finding a permanent home, not continually creating different kinds of temporary shelter.
We change the way families actually experience homelessness and the way they get out of homelessness.
And it works. Rapid rehousing gets families into permanent housing and back on their feet quickly. Using these strategies, Hennepin County, Minnesota has reduced the number of families in shelter by 43%.
In Hennepin County, we have a very short length of stay in shelter. Families stay in shelter for 30 days or less.
What Rapid Exit helps us to do is to determine levels of barriers, and that way we know what to address as far as trying to get them into their permanent housing.
Many families need only a few months of rental assistance to get back into housing, while others require longer-term help.
We want to get families out and into stable housing, return them to the community so that they're able to integrate all the pieces of their life again so they can continue on.
At the homeless shelter, a lady that was there, she referred us to that Shelter Plus Care program. I called them and they said, well, we'll be sending out a social worker. We just connected right then and there, and she's been helping us ever since. If it wasn't for her, I don't know where we'd be right now. Probably still out on the street, homeless. He's sick. He has cancer, and they also found that he was diabetic type 2. Right now I'm working at a donut place. It's a lot better having your own home instead of always being on the street. That's not right, not for kids.
It was hard until now. I'm gonna be a doctor. That's all I'm gonna do. Right, Mom?
Yeah.
In Hennepin County, 90% of families placed in permanent housing remain stably housed.
While there may always be people who from time to time are homeless, our dream, and we think it's a dream we can achieve, is that if people become homeless, that they'll be in short-term shelters, as shelters were originally designed to be, for 2 or 3 weeks before we're able to work with them to locate stable, supportive housing.
Communities are succeeding with rapid rehousing, in part because they are building relationships with private landlords.
I became homeless through a domestic violence situation. I left my husband in the middle of the night with just 1 diaper bag and 3 kids, okay, at midnight to get away. And I didn't think I was gonna make it, but I did.
The relationship that we have with landlords is in fact key.
The Rapid Exit Agency offers the landlord a win-win deal where the landlord really can't lose. They promise that if there are any lease violations, late rent payments, damage to the apartment, they will step in and make it right. And they do. They have to have that credibility with the landlord or the whole thing falls apart.
When I received my keys in my hand, it felt unreal. I'm like, wow. I feel like I have my life back.
These strategies are working all across the country, even in tight housing markets, in big cities and in small towns. When rapid rehousing is combined with targeted services, families increase their self-sufficiency and their well-being.
We very much want to rapidly rehouse families, but we also do not want them to rapidly return to homelessness. The key is going to be connecting them to the resources in the community.
We met Angela in October of 2005.
I had addictions. I had criminal records, unpaid bills.
We worked with her to overcome her drug addiction, got her involved in North Central Mental Health.
They have links to anything you can possibly think. I mean, counseling, meetings, parenting. There's, this place really, without them, I don't think that I would be as far as I am now. For somebody to be able to talk to you like this and know that they feel you without turning their nose down, that's enough to make you get up. That's a positive incentive right there to make you want to get up and try to do something.
Angela's doing wonderful. She actually moved out of the housing that we put her in into her own housing.
I'm smiling instead of crying.
Some families need more services, and with these innovative approaches, they get them.
She is bipolar, so...
I have a lot of mental illness problems. My mental illness is getting better because I do have my own place.
I was involved in a hit-and-run accident. The guy was doing 40 miles an hour. I was on the side of the street. There's a lot of things that I used to be able to do that I can no longer do. We had so much weight on our shoulders when this happened to us. When we got the okay that we could have this apartment, it's like somebody just reached down and lifted all that weight off our shoulders. Emotionally, it was instantaneous. Hey, we got a place to live. I can't cool, and it's our own apartment.
In Columbus, Ohio, 60 to 70% of all families exit into stable housing, and more than 90% never return to homelessness. Many communities are tracking results and using data to design and implement plans to end family homelessness. It's an important tool in these successful strategies.
We have been using performance-based data since 1996 to evaluate the quality of a program and what are the results that they achieve.
Data is at the center of it. So through data, we know how the collaborations are working, how the innovation is working.
We can compare across programs to see who's doing a good job, and then that becomes a benchmark for other programs to aspire to. So collectively, we keep raising the bar.
You can't just lead from the heart, you pull at the heartstrings. Your investors want to know that if I invest in this particular initiative or project, we'll get results.
Because we can end family homelessness, we should.
This actually works. It works to prevent homelessness. It works to end homelessness.
There's a lot of energy. It really is a movement that's been created around ending homelessness, but we have to capitalize on this moment.
That's the challenge, is for the communities to change the way they're currently doing things and try this new approach, and I know they will see significant results.
There's a lot of political will behind trying to end homelessness and implementing these strategies across the board.
These successful models are being exported to other communities as there's collaboration at the national level.
People who are a bit more cynical will come to us and say, you're never really going to end homelessness in the community. There will always be people that are homeless.
I've seen some tremendous changes in the attitude towards homelessness, the attitude that, this is an unsolvable problem.
We think, for all intents and purposes, that we will, in fact, by implementing our 10-year plan, end homelessness in this community.
We're talking about real people that have tremendous potential and their families, and that we can do some very positive things to keep them in permanent housing that will change their lives forever.
And so for people who tell me, you're just dreaming, I say, you bet. It's the American dream of safe and stable housing for every American.